Good afternoon, everybody. This is Sydney Haldeman. I am the NPH 2022 intern with the Northwest Arkansas Council Healthcare Transformation Division. This agency presentation is going to go over who the agency is, what the Northwest Arkansas Council does and their vision, the respiratory disease dashboard, which is my current project that I'm working on, and all the experience that I've been able to gain throughout this internship, or more specifically, what public health looks like in practice and in action. So the Northwest Arkansas Council is a private nonprofit organization that works toward advancing job opportunities, talent recruitment, physical infrastructure, healthcare, and quality of life in Northwest Arkansas. So most of the council's more than 100 members are companies like Walmart, Tyson Foods, J.B. Hunt, George's Incorporated. And on the right-hand side, you can see my preceptors, which is Ryan Core. He's the Director of Healthcare Transformation Division, and I work directly under Dr. Marty Sharkey, who is the Fayetteville City Health Officer. So the Northwest Arkansas Council's vision for Northwest Arkansas is to become a top 20 destination for health sector services. And what the Healthcare Transformation Division does is it is responsible for fulfilling those 6 objectives down at the bottom, as you can see, being home to a top-tier medical center, regional employment development, things of that nature. So working to develop not only the physical, but electronic and technological infrastructure that we have in the healthcare sector here in Northwest Arkansas. Part of that advancement and development in our electronic and technological public health infrastructure is where my internship position comes into play. I've been fortunate enough to work with Dr. Marty Sharkey, who, as I'd mentioned, is our city health officer, in designing the respiratory disease dashboard. And so what this is an internal interactive display of all of the critical metrics that stakeholders need to understand the burden and the spread of respiratory illnesses across Northwest Arkansas. So on the right-hand side, there are some unique attributes to this dashboard. One being that it is interactive, so users can meaningfully engage with the data that's being displayed. It's customizable, so you can understand the stratifications of different epidemiological metrics to better pinpoint disparities in the spread of respiratory illnesses. It's user-friendly as well, so the data that is being displayed is easily translated into information, and in that nature, it is accessible as well. And then most importantly, we want to make sure that the data that is being displayed, once easily translated into health information, leads to meaningful action, tailored interventions within the community, and more specific programs that help to eliminate health disparities and bolster our response to respiratory diseases within our region. So far, this internship position has provided me a very comprehensive exposure to foundational competencies. And while the project isn't done quite yet, I will go over my favorite foundational competencies that I've developed this far. So one being leadership, the exposure to the team of leaders that I am working with that are the most enthusiastic doers and dreamers has been priceless. And I've tried to emulate that through leadership in my own way by forging forward with this project, this dashboard, and really taking that autonomy within this position to develop myself as a great leader. I also have enjoyed the public health and healthcare systems exposure, understanding how communication works within one entity and how interagency communication has been very interesting as well, how different systems operate and how to increase that interoperability. As far as concentration competencies go, I have been able to examine how previous dashboards in other states have been developed and implemented, and have already spoken with the builders and designers of those to get a little bit more information about what those limitations were so that we can build this dashboard to be the best that it can be. And I've also, through designing this dashboard with the help of Dr. Sharkey, have gained experience in designing an evidence-based communication strategy. So this dashboard is designed with the idea in mind that it will one day be adopted at a state level and move from internal usability to external usability, meaning from private to public access. And so with that in mind, we have to keep some idea of flexibility in there and to be able to understand that the data that we're putting in here and displaying can be eventually translated into information that is digestible via the public. So exposure to public health informatics in practice, or understanding how systems of information operate and are transmitted and exchanged, has been personally the newest experience that I have gained from a public health internship. But also through this position, I have been able to experience networking on a level that I have never experienced before, much more professional, much more profound. Surveillance and epidemiology kind of sits at the basis of the goal of this dashboard. So improving Northwest Arkansas's respiratory disease surveillance in the first place, and having an epidemiological look with that so that we can do something with that data. And so that's kind of something that you have to keep in the back of your mind when designing this dashboard, or what I have had to do this far. And my favorite personal and professional area of development has been leadership, as I had mentioned in the previous slide. Not only the exposure to the great teammates that I'm working with, but also kind of emulating that through practice of my own, and taking this dashboard and forging through with it, and being a leader in that area. This internship position with the Healthcare Transformation Division of the Northwest Arkansas Council has highlighted the importance and the leverage that academic and professional partnerships have. I have gained experience in understanding the importance of connecting academics with public health practice, and I believe that the council has benefited from the relationship and the ties that their student, their intern, has with an academic institution. I've learned, of course, what public health looks like in practice, all of the limitations and all of the wonderful things, of course, as well. And then interprofessional and interdisciplinary collaboration. This kind of ties in with the systems thinking competency, in that understanding the scope of public health is not just healthcare and healthcare service oriented, but deals with every realm of life and is incredibly intersectional. So taking advantage of all of the networking opportunities, not in public health, but maybe in housing or food security, things of that nature, and using that to our advantage to improve the overall health and well-being of Northwest Arkansas residents. This is the Northwest Arkansas Council's general homepage. So it is hyperlinked, and I encourage everybody who is watching this to visit their website to learn a little bit more about the different sectors that they are involved in. As I mentioned, public health is very intersectional. So being an intern in the healthcare division was a wonderful opportunity, but there are also opportunities to make public health impact in the different sectors that Northwest Arkansas Council is involved in. So I encourage everybody to visit their website and learn a little bit more. Thank you for watching and listening.